impact of mental health problems on people's management of money?
It can be huge. It definitely does differ depending on the kind of specific sort of mental health problems. So everything I've been saying to the teams today are that different mental health problems are related to finances in a different way. So people with depression, when they're depressed, maybe avoid opening the bills, wait for them to stack up and then chuck them in the bin. Same with people who are anxious, they avoid looking at their bank statements. But then people maybe with bipolar disorder, when they're manic, might be very kind of disinhibited and spend quite a lot. A lot of people see it as random, but actually it's often kind of spending money to make money, so they've got this big business venture they want to go for. So it can have a really big impact. A lot of the people I work with in the NHS, sadly, are on long-term kind of disability benefits, so they really have to stick to a budget, and it can be hard at times because they're opening their bills or because they are kind of doing these impulse spendings. So I see people who in kind of 10,000 plus debt when they're on benefits, and psychologically it's like a massive weight on you, because you're never going to pay that off.
Do financial institutions, not naming any names, just generally speaking, are they sympathetic enough to the needs of people with mental health issues, or are mental health issues poorly understood at the corporate level, do you think, as well as at a personal level?
I can't really answer about individual kind of places. I mean, I know where I work, we have a financial advisor, so she does a lot of liaising with banks and financial institutions to something called the Money and Mental Health Evidence Forum, which actually even Theresa May mentioned a few weeks back, which is good, to try and just say about whether this person has capacity and whether they have the ability to pay it back. So I do think if it comes with a kind of doctor's letter, I have had clients who the debt kind of, you get a minimum repayment order, or some of the debt kind of gets wiped off, which is good. But again, I think sometimes maybe people think it's just kind of a bit of an excuse, and that's not the case. People are kind of oblivious to it, and people, like say when they're manic, will spend because they think they've found a £1 million business idea. It's really that goal focused, which is kind of really quite extreme. So they think they're kind of doing a get rich quick scheme. I mean, some research I'm working on at the moment, it's kind of counterintuitive for a while, but when you think about it, it makes sense. We found that struggling financially here in bipolar disorder increased compulsive spending here, which on the face of it, you're like, what? You're broke, so you're spending more. But this is the thing, is that often it's people are broke and they have a slightly grandiose, overly confident idea, so they spend money to make money, and the vicious cycle continues.
Last thing, you've been around the teams. What's your impression of the sort of ideas being thought about and what people are coming up with here?
I think it's fantastic. It's really nice just to have the sort of research I do and the clinical stuff I do, for there actually to be a kind of real-world, practical discussion here linking banks and finances. It's brilliant. It's like a dream come true for me. I've had kind of one of my own ideas, which I've discussed with some teams, but there's some really good stuff here talking about very clever uses of technology, which I didn't even know existed. So it's really exciting to see. And I'm just trying to inject a little bit of psychology and mental health. As I said, I think different mental health problems are related to finances in different ways. It's quite specific, so I don't think a broad brush approach is going to work. I think that's why they've got the kind of different case studies here. And so I've just kind of said to teams, I hope that they kind of focus on a couple of particular areas. So focus on impulsive spending or focus on avoiding bills, and try and really focus on that targeted approach is going to be the most effective. But it's very exciting. We're very glad to be here.
Excellent.